I'm Oscar Nzioka Mudini. I'm from Kenya, Machakos. I came for treatment. I was having multiple sclerosis and there was no better treatment in Kenya. So I came to India.
My name is Stephen Kilonzo. He's a relative of mine. He's my brother-in-law. I think there's a case for many patients with MS to consider coming to at least get their initial treatment or diagnosis from India. And I would strongly recommend using Doctors Beyond Borders as their partner in terms of making their arrangements to come, in terms of deciding where they will stay and getting placement for whichever hospital they would find adequate treatment and care for. Well, I guess multiple sclerosis in Kenya is a condition that a couple of people are battling with, but there's no clear indication as to how they've dealt with it. We've seen some patients who are seeing individual doctors, and so there is no clear mechanism or framework. So we reached out to an organization called Doctors Beyond Borders, who are in India, and we had heard a lot about different ways of accessing health in India. You do need to be handheld when you're in India because it's a very complex environment to navigate. And so one of our close friends who had also used Doctors Beyond Borders was very helpful in terms of pointing us in that direction. And we reached out to Doctors Beyond Borders to help us just determine from the beginning what it would mean for us and for Oscar once he got to India in terms of treatment. I think once we received the referral from Kenya regarding DBB, we initially got in touch with them via email, and then ever since then we have been in touch through different modes. They're constantly available on WhatsApp, they're a phone call away, and from the beginning, once we made the decision to work with them, they guided us through just the different options we had available. And I remember when it was time to get the visa, they quickly arranged for us to get letters to secure our visas for travel. They helped us in terms of working through the paperwork until we got here. So the process has been made a lot easier working with DBB in terms of transitioning from Nairobi to India. We've always known and heard that India is greatly known for advanced health technology, and so we sought the services of a partner to see how we could advance the opportunities for treatment for Oscar. MS is a very complex condition, and I think we have looked at options before. I think what we found in India has been advanced treatment options that have not been available to us in the past. And so one of the things we are walking away with is the latest technology, availability of drugs which were not available to us in the past, which would greatly help any MS patient who's looking to improve their quality of life. Having reached out to a couple of individuals who initially were willing to help us with finding our way into navigating this difficult environment that is in India, we talked to Doctors Beyond Borders, and we found that they had a very structured way of engagement. They had a large database of doctors, a large database of medical institutions, and therefore it was easy for them to place us where we felt comfortable to deal with Oscar's case. But more importantly, I think the nature of engagement was very calming. We met and engaged with individuals within Doctors Beyond Borders who are very polite, very encouraging. They put us at ease. They helped us feel that we were dealing with the right people. They went beyond their call of duty just to make us feel comfortable that they were doing everything to provide us with the options that we needed to consider in terms of deciding which direction to take for Oscar. So generally they had a very good understanding of the environment. They had a good database of people to consult with, and of a couple of conversations that we had with them and different correspondence, we ultimately felt that they knew what they were doing. We've been here for a while, for about a week in India, and since we arrived, the treatment we've received from both DBB and the hospital where we've been admitted has been exemplary. We've been treated with a lot of care, right from the airport, right into admission, and just the daily routine of going through the process of treatment has been extremely encouraging and settling for Oscar, and even for us who brought him here. Well, we first started talking to Varun of Doctors Beyond Borders right from the beginning, before we then ultimately met the wider team that works at Doctors Beyond Borders. And I must say Varun has been very helpful. I think the essence of Doctors Beyond Borders and just the nature and the culture of Doctors Beyond Borders is well captured by Varun's demeanor and his ability to really put you at ease. He was very knowledgeable, he was very reliable, and his advice was always spot on. So dealing with him, as I said, at some point I thought Varun was a doctor, but only to realize that he has learned to put all these pieces together in such a way that gives everybody the confidence that really you require to make the difficult decisions at such a time. We have, from the beginning, worked very closely with Doctors Beyond Borders. They were efficient, they were reliable, they were consistent, and they knew what they were doing. I think just from the day we made the decision to work with them, we haven't been disappointed. And we feel that had it not been for Doctors Beyond Borders, it would have cost us more. It would have been a little bit more difficult for us to know, how to navigate around. It would have been difficult for us to identify the doctors we've worked with, to identify where we ended up, and also to find just general accommodation that has worked for us. I think we have found that the overall experience with Doctors Beyond Borders has added significant value for us, and would greatly recommend anybody who's looking to come to India to reach out to them and just get a sense of what kind of support they can receive from Doctors Beyond Borders.